Hi, I'm Dr. Marc Sklar, the fertility expert, and welcome to Fertility TV. In this episode, we're going to be talking about the different variations of PCOS. So if you have PCOS or think you have PCOS and want to learn more, then stay tuned. Hi, I'm Dr. Marc Sklar, the fertility expert, and I work with couples from all over the world and locally here in San Diego to help them get pregnant. And one of the more common things that I see is PCOS. And in a previous video, I talked about what PCOS was. And in this one, I'm going to talk about the different variations of PCOS. Now, I know that might sound strange to all of you because most women are told and made to believe that PCOS all looks the same. There's one type of PCOS, and either you look that way or you don't. I'm here to tell you that I don't believe that that's accurate. So the four key features that are important to recognize that women may have or may not have all of them are these four. One is an irregular cycle or no cycle, but we'll call it irregular cycle. Two is increased androgens, which can be testosterone, DHEA, and so forth. Three is unwanted body or facial hair. And not only, kind of like the beard, hopefully not excessive as mine, but also down below the navel as well. And then around the nipples. And then four is polycystic ovaries, which you have to see at least on an ultrasound to visually inspect them. Now, I say the variations of PCOS because I believe there's about 10 variations. If we want to really condense it, then there's probably the more common 3 or 4 types. But the 10 variations or upwards of 10 variations are basically the different variations of these four. Do you have all four? Do you have just 2 of those? And do you have which 2 of the 4 do you have, right? And those variations. So you can have a combination of all of those, which will basically make you look and present a little bit different than the classic PCOS type. Additionally, this will affect your treatment. So if you have all 4, then I would treat you very differently than if you just had 2, and depending on what those 2 are, right? Or 1. So because there's all these different types of variations, treatment has to be laid out appropriately for each one of these. So that's also why it's important to use testing to see what your hormones are like and what they're doing, because based on what your hormones look like, that will also play a part in what variation you have, and then obviously the treatment for that. You'll notice that in all of these, I don't mention as a variation blood sugar. And the reason for that is because blood sugar is pervasive and underlying in all of them. Underlying in any variation is some aspect of a blood sugar dysregulation. It could be as extreme as diabetes or just a little dysregulation. It really just depends, and that variation will depend on the form of treatment we use to regulate blood sugar. But for sure, with PCOS, there's always some sort of blood sugar issue going on. And the last thing I want to cover in this video is what I call atypical PCOS body type, or the thin PCOS type. So about 50% of my patients who come in with PCOS are thin, petite, and don't look like they have any classic signs or symptoms of PCOS. But once we do some testing, we do realize that they do have that. And maybe one of the more common signs that they have is maybe an irregular cycle. I find this typically in women who started exercising in their teenage years during puberty. And because of this fluctuation and shifting and increase of hormones, in addition to this intense working out, because they're not working out, but they're playing a lot of sports, this kind of chemistry mixing up of hormones at this age really causes an explosion and really triggers PCOS. It causes an increase in androgens and causes a dysregulation of hormones. And unfortunately, that's a hard pattern to break because women who start at a young age like that, they're predisposed to wanting to exercise and work out. That's part of who you are as your personality. And so that's a hard thing to regulate and pull back on. So those are the different variations that I typically see of PCOS. If you want more information on PCOS, then you can find that in some of my other videos.
If you're watching this, you must be wanting to get pregnant. This is my gift to you, the Fertility Anti-Aging Manual, the ultimate guide for anyone trying to conceive over 35. This is the manual that's going to help you be even more fertile than you were in your 20s. Download the free Fertility Anti-Aging Guide now by going to the link below or click here for direct access.